Today, I'm going to talk about various skin booster types, features, and latest trends. The contents will be various skin booster types and features. The first one will be hyaluronic acid and others. And second will be polymers. Third will be exosome, which is very hot in Korea right now. And the next part will be latest skin booster treatment techniques used in Korea right now. So we all know that our skin ages as we get old, and we see the degradation of collagen fibers and other extracellular matrix. And we know that fibroblast is the key player in aging or prevention of aging. We all care about our skin quality, which means skin texture and pores and skin tone. When we get old, when our skin is damaged, we see our skin is very dry, very rough, very darkened. So in order to improve this one, in order to solve this problem, that's when we need a skin booster. So skin booster is to improve our skin texture and some pores and overall skin quality. So what is a skin booster? Is by definition, it is a solution or materials that can enhance the skin quality by injecting those materials into the skin. So skin booster treatment enhances the skin self-regeneration by nourishing the depleted dermal layer and improving the skin environment affected by external factors. So when we see damaged skin, we inject some active ingredient and then we make the skin healthier. So we recover the skin. ECM is the target of the skin booster. So the first one will be, here is all the target, ECM, fibroblast, elastin, collagen, hyaluronic acid. It's all the target of the skin booster. Something is like a skin booster itself, which is HA is the skin booster. And polymer, it is a collagen stimulator. So it makes the skin to boost the production of collagen. And exosome, which is not only collagen stimulator, as well as other good cellular functioning, all like not just collagen booster, but overall skin quality. And I told you about the skin booster, biostimulator, collagen skin booster, and some HA stuff. But in addition to those stuff, there is other antioxidant, vitamins, minerals, and amino acid. And these all are the player of the skin booster. And the skin booster is very popular in Korea right now. It's an emerging market. So let's look at the history of a skin booster. Well, this is not definite true. Well, some people think differently, but for your convenience, we classify the skin booster into 5 generations. First generation is just for moisturization. This is just for hyaluronic acid. This is just the first generation. And the second generation is the HA plus other combined complex of active ingredient, such as vitamin and minerals. And third generation is a salmon DNA, which is a polynucleotide. As you all know, that Rijuran is one of these third generation. And the fourth generation is a polymer. It boosts elasticity. So it's a PLLA or PDLLA is the fourth generation. And the fifth generation is exosome. It's a cell signaling agent. It's anti-inflammatory, whitening and to prevent pigmentation. So we all go one by one. You all know that HA, hyaluronic acid, is just a commonly product injected into the skin through microneedles to give the skin a very hydrating or very rejuvenating skin. So they also stimulate collagen and elastin production at the cellular level. So when we get older, the HA gets less HA in the skin. So in the result, we see very dry skin, aged skin, and we see wrinkles. So the famous one I'll introduce here is Restylane Skin Booster Juvederm Volite Teosyal. And from Jetema, we have Viten Hydro and Hydro Plus. So clinical effect is Brightening, I think the first one is brightening, and then it can improve the skin quality, but not so much about skin elasticity or fine lines. But I think brightening is the primary effect of this HA skin booster. So here is the clinical result of a B10 Hydro. After three treatment, we see skin moisture improve the triple, like from the 1.5 times 150% increased after treatment. And the second generation is HA plus rejuvenating complex. The famous one is NCTF Boost 135 HA. It's in addition to HA, is vitamin and amino acid is included here, and it's also used face rejuvenation. I go this way. Let's go to third generation is a PN, polynucleotide. And polynucleotide, it is different from PDRN. In terms of their DNA fragment is much longer than PDRN. So it stimulates growth factor and it's very safe compared to other like fourth generation polymer. So if you look at the size, PDRN is like 350 kilodalton, but PN is 1000 kilodalton. So it's very large, complex DNA molecule. And so the effect when we expect from the PN is a skin hydration, overall improvement of facial pores. There is a treatment here, it's a V10 PN case here. After treatment, we see the improvement of skin acne, scar, skin after 3 treatment. And the fourth generation, polymer, and fourth and fifth, I think is the most popular in Korea right now. Polymer is just a high molecular weight compound that contains multiple repeating units in this structure. Primary goal of polymer is volume enhancement and scar improvement, and also pore improvement and texture improvement. Well, here we see a famous brand here. PCL, I think, is the firstly used in Korea. It's Elance. It's the volumizing effect is the largest, but right now I think it's not famous as before. It's PLLA. I think is Galderma has this Sculptra. So volumizing effect is quite good. Because of some granuloma formation, it's not as popular as before, but still we use a lot of PLLA right now. And the third one is PDLLA. Is the brand name is Juverup. I think it's the most popular in Korea right now. Some volumizing effect, intradermal injection is possible, and the risk of a granuloma formation is very low. So that is why it's PDLLA is right now is very popular in Korea. And PDO, I'm not sure about the PDO, but there is a brand called Ultracool, and some people use this polymer right now. So clinical effect of a collagen stimulator, whatever the kind is very, I think is all proven. So it has some collagen stimulating effect. So for like here, PDLLA and PCL has a large volumizing effect, and compared to those, PDLLA has less volumizing effect, but they have volumizing effect. It's proven. So what is the mechanism? When you inject the first, then it has some water and HA and polymer together. Immediate volume effect from water or HA. When the water and HA is observed into the skin, second phase is the polymer stimulates the fibroblast to produce collagen. So after 3 or 6 months, there is a collagen production here. So it's a volume is enhanced. So when you look at the degradation period, HA filler has 6 to 12 months. So it's we say 1 or 2 years, but it's longer than before. And the polymer here, PLLA, PLA, PCL has degradation period is 1.5 to 2 years. So 1 to 2 years. So it's longer than HA. And PDO is kind of a little bit short. So it's 6 months, so less than 1 year. So this is why PLLA or polymer is currently very popular in Korea right now, because it has more longer degradation period. So today's key is exosome. What is exosome? Exosome is a type of vesicle that is produced within cell but released into the extracellular space. They have here, if you look at the figure, you see there are many proteins, RNAs and DNAs, amino acid and metabolite. And they serve as very good beneficial functions. And we expect this component here, ingredient here, will do a good function into the skin. And when you look at the size, it's a 30 to 150 nanometer when we go back. Compared to polymer, polymer has a micrometer, so unit is quite different, much more smaller. So it's 1,000 times smaller than the polymer. I think this is why this is really safe. Exosome is really safe skin booster compared to polymer. So it has angiogenetic ability and collagen synthesis and regulation of inflammation. There are 3 types of exosome so far. And the famous one is adipose stem cell derived exosome. And the second one is microbe derived exosome. It's from the human microbiome. And the third one is plant derived exosome, which is quite the trend for future trend is a plant derived exosome. And ASCE is from the liposuction, we get adipose tissue, and from these cells, we get exosome from this cell. So it is from the human. It is I think the functional effect of this ASCE is quite good, but it is really hard to get mass production of ASCE because we need a human to make this one. And the famous brand in Korea is ExocoBio ASCE, and they are 2 vial, and they are all lyophilized, which means a dry powder in vial. And there's an article that shows the efficacy of ASCE, and it shows the wrinkle improvement and skin moisture and skin elasticity. Also, redness was improvement after the exosome treatment. This patient has redness from the dupilumab-related facial redness. There are another brand, AAP cell exosome. It's also ASCE lyophilized solution. Usually we have 2 different vial 1 and vial 2, and we mix it together to make the effect, to maximize the effect. So it also shows the improvement in skin aging, and some fold was improved, a freckle was improved. Why plant-derived exosome is the future trend? Well, it's not definitely true, but we think it has the less risk of infection compared to mammalian-derived exosome. It has less allergen and less ethical concerns because we don't need animals to make this exosome, and less contamination and much more consistency and quality control. And because plant-derived exosome is quite easier compared to mammalian-derived in terms of mass production. So in JETEMA, we have Exsolution. It's a liquid type and it's proven efficacy and safety. And it's safer exosome because it's plant-derived exosome compared to mammalian-derived exosome, I told you before, has lower toxicity, lower immunogenicity, and lower potential for allergic reaction. And it has anti-inflammation and regeneration because we have some plant, exosome is from the plant Centella asiatica, Edelweiss, and 3 more. So there are 2 vials. First one is like mineral amino acid vitamin. Second vial is the exosome. So it has 5 different plant-derived exosome. So the liquid type has better compared to lyophilized type because there is no need for antifreeze for liquid type. If you have antifreeze, it has more like risk of a cell membrane damage. So exosome damage can happen when you put antifreeze together. So there is less, I think liquid type is a better formulation compared to lyophilized type. When you look at the exosome, the number of exosome is very important. So when you look at these different, compared to product A, Exsolution has a exosome particle has 6 billion in 2 milliliter, and product A is 2.75 billion. So much more exosome particle in Exsolution. And the safety and efficacy was proven. I'll show you the clinical result later. And so, when you look at the pore elasticity was improved by exsolution, pigmentation was improved, skin tone was improved, all sebum was reduced, and moisture level was increased after exsolution, and very low irritation risk of exsolution. So when you look at the case study, I'll show you several case studies here. We did a manual injection. We had compared head-to-head comparison study with NCTF and the ASCE. Compared to NCTF, the result is we checked the pore size, wrinkles, elasticity, skin texture. Overall parameter was better in exsolution group compared to NCTF, the statistically significant improvement in exsolution group. So we think exsolution has more beneficial effect compared to NCTF. And when you look compared to ASCE, the result was similar. Both group was improved. But when you have troubled skin, I think exsolution has more like a better improvement in patient with troubled skin. So as we are out of time, I'll go to the last chapter. This is the latest skin booster treatment techniques in Korea. And well, in addition to manual injection, this is a manual injection, but we have many different devices that we to make the skin booster injection. So we are using micro needling RF right now. Needle RF is Potenza is kind of popular in Korea right now. Secret and from Iruda, other many different devices is used in Korea right now. Neither RF plus pumping, we can do pumping. The device I'm using is a double type. This one is a RF device, and I really like this one, but 3D needle RF plus injector device. So it's a drug delivery system for skin booster. So when you look at this one, blue one is the methylene blue. This is when you see, you can see that there is some booster is going into the skin. So it's epidermis and dermis area. Well, epidermis is kind of very thin. So this is me. I'm doing, so it's not really painful, but I do this by myself. And I do needle RF into my skin. And I'm like, by doing this, I'm making a channel into my skin. So after all this procedure, so after this, I put the exsolution here. This is exsolution. And I did, this is a drug delivery system. And if you put the exsolution into the face, as I have a channel on my whole face, the exsolution will go into the skin. So well, it's a very early stage, so comparison before and left side before and right side after. Maybe we don't see really a big difference right now, but from my subjective feeling, I feel my skin quality got really better after exsolution. Well, thank you for listening.